Hello. Welcome to the Pars Health TV channel. We hope you're having a good day and you are happy and healthy. In this channel, we give you tips to keep you healthy and out of trouble. In this video, we want to talk about most common thyroid problems, symptoms, and treatment. This video is for educational purposes only, and if you have any specific condition or illness, you should consult with your doctor. The thyroid produces hormones in the body. That's why we say it plays an important role in many various systems of the body. While your thyroid makes either too much or too little of these essential hormones, it's called thyroid disease. There are several types of thyroid disease, including hypothyroidism, thyroiditis, and Hashimoto's thyroiditis. In this video, we are going to be sharing with you some helpful information about thyroid diseases and their symptoms and treatments. Stay tuned with us. If you like topics like this, make sure to subscribe to our channel and press the bell icon to see daily videos just like this one. Alright, let's get started. What is the thyroid? The thyroid organ is a small gland located in the front of the neck, covered around the windpipe. It's shaped like a butterfly, smaller in the middle with two wide wings that spread around the side of the throat. You have glands throughout the body, where they produce and release substances that stimulate your body to do a specific thing. Your thyroid creates hormones that assist handle many vital functions of your body. When your thyroid doesn't work well, it can influence your entire body. If your body produces too much thyroid hormone, you can develop a condition called hyperthyroidism. If your body produces too little thyroid hormone, it's called hypothyroidism. Both diseases are serious and need to be treated by your healthcare provider. What does the thyroid do? Thyroid has an essential function to do within your body, releasing and managing thyroid hormones that regulate metabolism. Metabolism is a process where the food you take into your body is converted into energy. This energy is used throughout your whole body to keep many of your body's systems working accurately. Think of your metabolism as a generator. It takes in raw energy and utilizes it to power something bigger. The thyroid manages your metabolism with a few particular hormones such as T4, thyroxine, which includes 4 iodine atoms, and T3, triiodothyronine, which contains 3 iodine atoms. These two hormones are produced by the thyroid and they tell the body cells how much energy to work. When your thyroid works well, it will keep the right amount of hormones to maintain your metabolism working at the right rate. As the hormones are applied, the thyroid produces replacements. This is all controlled by something called the pituitary gland. Located in the center of the skull, below your brain, the pituitary gland monitors and manages the number of thyroid hormones in your bloodstream. When the pituitary gland senses a lack of thyroid hormones or a high level of hormones in your body, it will modify the amounts with its hormones. This hormone is called thyroid stimulating hormone, TSH. The TSH will be sent to the thyroid and it will tell the thyroid what needs to be done to get the body back to normal. What is thyroid disease? Thyroid disease is a general term for a medical condition that prevents your thyroid from producing the right quantity of hormones. Your thyroid typically creates hormones that maintain your body functioning regularly. When the thyroid makes too much thyroid hormone, your body utilizes energy too quickly. This is called hyperthyroidism. Using energy too quickly will do more than make you tired. It can cause your heart to beat faster, cause you to lose weight without trying, and even make you feel nervous. On the flip side of this, your thyroid can make too little thyroid hormone. This is called hypothyroidism. When you have too little thyroid hormone in your body, it can make you feel sleepy, you might gain weight, and you may even be unable to tolerate cold temperatures. These two main disorders can be caused by a variety of conditions. They can also be passed down through families, inherited. What are the common symptoms of thyroid diseases? There are a variety of symptoms you could have if you have a thyroid disease. Unfortunately, symptoms of a thyroid condition are usually very similar to the signs of other medical conditions and stages of life. This can make it tricky to know if your symptoms are linked to a thyroid issue or something else entirely. For the most part, the symptoms of thyroid disease can be divided into two groups: those related to having too much thyroid hormone, hyperthyroidism, and those related to having too little thyroid hormone, hypothyroidism. Symptoms of an overactive thyroid, hyperthyroidism, can involve feeling anxiety, irritability, and sensitivity, having trouble sleeping, losing weight, having an enlarged thyroid gland or a goiter, having muscle weakness and tremors, having abnormal menstrual periods or having your menstrual cycle stop, feeling sensitive to heat, having vision problems or eye irritation. Symptoms of an underactive thyroid, hypothyroidism, can include feeling tired, fatigue, gaining weight, experiencing forgetfulness, having frequent and heavy menstrual periods, having dry and coarse hair, having a hoarse voice, experiencing an intolerance to cold temperatures. How is thyroid disease treated? Your healthcare provider aims to restore your thyroid hormone levels to standard. This can be done in a variety of ways, and each specific treatment will depend on the cause of your thyroid condition. If you have high levels of thyroid hormones, hyperthyroidism, treatment options can include antithyroid drugs, methimazole and propylthiouracil. These are medications that prevent your thyroid from making hormones. Radioactive iodine. This treatment damages the cells of your thyroid, preventing it from making high levels of thyroid hormones. Beta blockers. These medications don't change the number of hormones in your body, but they help manage your symptoms. Surgery. A more permanent form of treatment. Your healthcare provider may surgically eliminate your thyroidectomy. This will stop it from producing hormones. However, you will require to take thyroid replacement hormones for the rest of your life. If you have low levels of thyroid hormones, hypothyroidism, the main treatment option is thyroid replacement medication. This drug is a synthetic method to add thyroid hormones back into your body. One drug that's generally used is called levothyroxine. By using a medication, you can control thyroid disease and live a normal life. Is there a higher risk of developing thyroid disease if I have diabetes? If you have diabetes, you're at a higher risk of developing thyroid disease than people without diabetes. Type 1 diabetes is an autoimmune disorder. If you already have one autoimmune disorder, you are more likely to develop another one. For people with type 2 diabetes, the risk is lower, but still there. If you have type 2 diabetes, you're more likely to develop a thyroid disease later in life. Regular testing is suggested to examine for thyroid issues. Those with type 1 diabetes may be tested more often, shortly after diagnosis, and then every year or so, than people with type 2 diabetes. There isn't a regular schedule for testing if you have type 2 diabetes, however, your healthcare provider may suggest a schedule for testing over time. So, if you feel tired without any reason, or you are experiencing abnormal weight loss or weight gain, see a doctor as soon as possible to check your health conditions. If you are interested in videos like this, make sure to like this video and subscribe to our channel. We hope you have a wonderful day. See you in the next video.